Welcome, everyone. Thank you very, very much for turning up live here, and welcome to everybody who's watching the recording later. As you can see, I'm in a sunny background here. No, that's not real. I wish it was. But welcome back to Dr. Paul Holman. He's very, very kindly agreed to do a talk about the vagus nerve, and also all these new devices and gadgets that are supposed to stimulate the vagus nerve and cure everybody. So we'll hear it from Paul today about what he reckons about all of this. So keep your audios off, keep the videos off while we record, and then afterwards we can stop recording and you can have some questions with him. Thank you very much, Paul.
Thank you, Peter. Thank you for everybody turning up today. We're going to talk about the vagus nerve. First, however, to make sure we're sharp, we're just going to do a couple of rounds of seated picking grapes. I'll just remind you about that. So we are going to raise our hands and we're going to breathe in through the nose 4 times. And then we're going to, with the same breath, we're going to pick grapes 4 times. Let's check that out and do it a couple of times. Once more for luck. Good. Okay, so the vagus nerve. Such a lot about the vagus nerve at the moment. Such a lot. And when, of course, we see such an explosion of information, advice, and technology around a health issue, we know that a lot of that is just going to be sheer nonsense. And digging down to what is real in all this discussion about the vagus nerve at the moment is quite problematic. So I'm just going to tell you my take on things. It's just my take on things. But I've been trying to dig down into the literature, looking at devices, etc. And I have formed my own conclusions for what they are worth. So, first of all, any discussion about the vagus nerve, of course, is predicated on being clear about the sympathetic and the parasympathetic nervous systems. I'm not going to go into that in detail, but in short, the sympathetic branch of the autonomic nervous system is that branch which facilitates work, action, and in the extreme circumstance, flight and fight. Most of the time, it's not in flight or fight. It's facilitating action, our interaction with the world. It starts cranking up in the early hours of the morning, so that by the time we're woken, the sympathetic nervous system is charging up to peak around 2 o'clock in the afternoon. And that increase in sympathetic activity is mirrored by an increase of the stress hormone, or the action hormone, as one might call it, cortisol. So the body's temperature and cortisol and mood all follow roughly the same trajectory, which is to start off in the late hours of the night, gradually increase, peak after lunch, and then gradually go down as the day progresses. The sympathetic nervous system is balanced by the parasympathetic nervous system. Parasympathetic, as you all know, is rest, digest, and recover. These two parts of the autonomic nervous system are in constant up and down balance with one another throughout the day. They're constantly adjusting one another to suit the circumstances in which we find ourselves. Even during the sympathetic phase or action phase of the day, the parasympathetic is asking us to slow down periodically in a so-called ultradian break, to take a short break, to rest, have a snack, maybe have a drink, and just take a pause for a reset. These ultradian rhythms are super important. The main cause that our system gets stuck in a stress overdrive is that we have been overriding our ultradian breaks. I've talked about this before, but it's worth saying again. In the old days, you go to work, middle of the morning, you'd have a break. The morning smoko. Then you'd have a break at lunch. Then you'd have a tea break in the afternoon. Then you'd go home, you'd have dinner, and you'd wind down in the evening. That does not happen so much now. People tend to work through lunch even, which is probably the worst thing you can do to your system. Have lunch on the go. Have any meal or eating activity on the go is absolutely the worst thing you can do. And to eat without some period afterwards to rest and digest is also probably one of the worst things you can do to your system. In relation to that, I think again I've quoted before a large study in Greece which looked at 30,000 men, whether they took a siesta or not after lunch. If you regularly took a siesta 3 or 4 times a week, you were 30% less likely to have a heart attack. I think that speaks for itself. So sympathetic and parasympathetic are in constant balance with one another, adjusting one another, and ideally in a hunter-gatherer life, which our ancestors were leading for hundreds of thousands of years, we would only be working in inverted commas, i.e. hunting or gathering, for 30% of the time at most. The rest of the time we'd be resting, digesting, chatting, doing light activities, etc., etc. Again, that does not happen now. So we tend to be stuck in chronic sympathetic overdrive. By the way, a note on the word sympathetic. It seems an odd word to use for that part of the system, which is into action, work, and flight and fight. It was coined originally by the ancient Roman physician Galen, who saw these little nodules of nerves running down the side of the spine, and he thought they acted in sympathy with the main part of the nervous system, which was inside the spinal column. So he called it the sympathetic nervous system. Parasympathetic means beside or in complement with the sympathetic. Another thing I want to say about the parasympathetic nervous system, because we'll mainly be talking about the vagus. There are 2 parts to the parasympathetic nervous system. The vagus, which does its work mainly in the thorax and the abdomen, There's also part of the parasympathetic nervous system, which you never hear anybody talking about, which comes out of the tailbone and innervates all the pelvic organs and some of the lower gut. Some people, both in traditional yoga and in modern relaxation theory, have suggested that the parasympathetics coming into your pelvis are by far the best parasympathetics to relax. And in yoga, you talk about Muladhara chakra, the chakra at the base, really right at the base of your spine. That's the chakra to address first before you address all the other chakras coming up to the brow. Because it's the Muladhara chakra which holds fear more than any other part of the electromagnetic system. Some people say consistently remembering to relax your pelvis. That means relaxing your lower back, maybe relaxing the pelvic floor, is probably the best way to relax the whole system. But you don't read much about that or hear much about it, and I won't say anything more about it today because we are talking about the vagus. Anatomy of the vagus. It's a tenth cranial nerve. That is, it comes out of the base of the skull. It works its way down in line with the carotid artery and the jugular vein. So when you feel your carotid artery and trace it down, you can feel the path of the vagus nerve. And there's a branch of the vagus nerve, the auricular nerve, that comes out of the top and goes into the ear. And more about that in a moment. The vagus nerve, because it's in the carotid sheath, is fairly near the surface. It's right there by the carotid artery. And because of that, you can directly palpate the vagus nerve. And I first learned this when I was a medical student because my mother had something called paroxysmal tachycardia. This is a condition where your heart just suddenly races off up to 200 beats a minute for no apparent reason. It's very scary. It's very frightening. And I somehow learned that you could sometimes turn this off by massaging the vagus nerve as it runs down the neck. And I was able to do that with my mother. I was able to turn off her paroxysmal tachycardia attack by massaging her neck. Pretty impressive stuff. A very simple remedy for quite a dramatic and a frightening condition. And the interesting thing about the vagus nerve, it comes down the neck, goes into the thorax, where it innervates the heart, the lungs, then it goes into the abdomen and innervates all the organs in the abdomen, especially the gut. There's one on each side, so we have bilateral vagus nerves. Now, the interesting thing about the vagus nerve is that 80% of the fibers in the vagus nerve are sensory. They're there to convey information about the body to the brain. Only 20% do stuff like regulating the digestion to make sure the peristalsis of the digestion is nice and smooth, the thing that goes wrong when you have irritable bowel, and regulates the heart. It has innervation in the lung for other reasons as well. But the main thing we're interested in is the gut and the heart. And the heart is a good example of the sympathetic and the parasympathetic nervous systems just working with one another all the time. They're monitoring and balancing one another all the time. So that when we take a breath in, our pulse increases, the sympathetic tone has increased to increase our pulse. When we breathe out, the parasympathetic tone towards the heart increases and our heart slows down. Just check that out a minute. Take your pulse at the neck. Take a deep breath in and out. It's quite noticeable. We learn from that on exhalation, the vagus nerve is stimulated. And that's, of course, an important fact to know when we talk about breathing practice in the vagus. With the digestion, you've got sympathetic and parasympathetic again, riffing off one another, balancing one another. When I trained in bioenergetics in London in the 70s with this Norwegian woman called Gerda Boyesen, and some of you will have heard me say this before, she used to do a particular sort of massage to relax people. And she had a big stethoscope with a very long tube that she could place on your stomach while she was working and still move around you while listening to the digestion sounds. She knew when you were relaxing because the digestion sounds would increase and change their quality. Certainly the only person I knew who'd ever monitored the parasympathetic nervous system through the digestive sounds, but it was very effective, very simple to do, something you can do. If you've got a spare stethoscope, you can listen to your digestive sounds and monitor them when you're stressed and monitor them when you're relaxed. Okay. But this is the important thing to remember. 80% of the nerve fibers in the vagus are sensory. They're sensing what's going on in your body. And that is what it's all about, sensing what is going on in the body. So that when we are doing low, slow, relaxed abdominal breathing, vagus nerve sends signals to the limbic system, which is registering for threat. Everything is fine down here. No need to worry about what's going down here. This is one of the virtues of the low, slow abdominal breathing. The relaxed breathing sends messages to the limbic system, the amygdala, parts of the cortex which register emotion and internal bodily signals like the insula, anterior cingulate cortex. Everything is fine down here. And this is a major way we can feed back and control the brain's response to the here and now by the breath. Okay, now I've been talking for about 20 minutes. If you've been focusing in on what I'm saying, it's time for your nervous system to have a little break. Once we're concentrating for more than 20 minutes, we're really stressing our system too much. Particularly as you get older, you feel this. So for 1 minute, we're just going to sit back and do our default low, slow, relaxed abdominal breathing. One cannot overemphasize. I'll say it again. One cannot overemphasize the importance of a frequent break. Either the ultradian break every 2 or 3 hours for 20 minutes, or more often, especially if you're doing work on a screen. If you're doing work on a screen, your focus is narrow. Narrow focus is stressful. This is such an important one-liner. Narrow focus is stressful. Don't spend too long in narrow focus. If you do, you're chronically stressing your system. So, this is where open focus comes in. If you catch yourself narrowly focusing for too long, do a reset. Do a reset. Sit quietly. No more than a minute. Open your awareness. Open your focus. If you can, feel that your awareness is expanded out in all directions to infinity. My awareness is expanded out in all directions to infinity. It's easy to do, actually, once you get into it. That is so relaxing for the system. Many years ago, in one of the early experiments on psychological factors in blood pressure, they had two groups of people, told them, all right, one group, here's some sums to do. The other group, they just gave them a pleasant scene to look at. But of course, within a short period of time, the group doing mental arithmetic, their blood pressure went up. It's a short period of time. The blood pressure remains up as long as you're doing concentrated, narrowly focused mental work. Basically, left brain work. It's an absolute no-brainer. Similarly, with the immune system, and we'll talk a bit about the immune system a little bit later on. If you take a blood sample of people just going into an exam, certain fractions of their white cells will be suppressed. The immune system does not like stress. In fact, as we'll discuss a bit later on, it's pretty clear now that the brain and the immune system they're basically one organ. They should not be divided. They are one organ of awareness. And they're like that. They're talking with one another all the time in enormous detail. And I don't think that's a question anymore. The data is there to support that view completely. So a lot of stuff about the vagus nerve. It all started with polyvagal theory and trauma theory, and they've given rise to all sorts of avenues of inquiry about the vagus nerve, etc. But there is so much misinformation that it has been a great treat. It's another book I'm going to show you. Kevin Tracey, The Great Nerve. Kevin Tracey, this is 2025. It's a great book about his research on the vagus nerve and about research on other uses of vagus nerve stimulation, particularly in epilepsy and depression. But there's nothing like a solid, coherent account from a leader in the field, summarizing what's been known for sure so far and separating the wheat from the chaff. Kevin Tracey basically is the man who discovered that stimulating the vagus nerve reduced inflammation. Now, stimulation of the vagus nerve had been around for a while. In fact, as he points out, in the 19th century, there was a Dr. Corning in America who was electrically stimulating people's vagus nerve for epilepsy, using a very crude and sometimes dangerous device. It really wasn't, of course, until the technology had improved enormously that people thought about stimulating the vagus nerve, excuse me, in the 20th century for epilepsy. And it wasn't until the late 80s that they had started to successfully implant a vagus nerve stimulator, a little collar which you put around the vagus nerve, and which delivered small little electric currents several times during the day for just 3 or 4 minutes to stimulate the vagus nerve, basically telling the brain all is well, and therefore calming the brain, and therefore making it less likely that you'd have a seizure. They found it worked pretty well for epilepsy, then applied it to depression. But I don't think it was until 2005 that the FDA actually approved these devices for the use in depression. You get a pretty good result in depression. 30 to 40% of people have a good response to vagal nerve stimulation. But it wasn't until 2011 that Kevin Tracey published his initial work on vagus nerve stimulation and inflammation. And his experimental setup over the years has been very neat, because you can take an experimental animal or a human being, you can take a blood sample, and you can measure some of the inflammatory products in the blood, like interleukin 6 or TNF alpha. And then you can do a period of vagus nerve stimulation, take the blood again, and see what's happened to inflammation. So a very neat and clear-cut experimental setup. And lo and behold, it's a very reliable effect. So the first chap to have a vagus nerve implant for inflammation was, I think, no, I made a note of this earlier. Hang on a minute. Yeah, 2011. He was a chap in Sarajevo with very severe, long-standing rheumatoid arthritis, not particularly responsive to drugs. He had a device which Kevin Tracey had designed, put into surround his vagus nerve. He had intermittent electrical stimulation of that. Within a few weeks, there was improvement. Cut a long story short, he seemed to become completely free of pain and inflammation. So that set further research into motion. And it's only in this last year that Tracey's particular device for inflammation, the set point device, it's called, has been approved by the FDA for use in humans. This doesn't mean to say that people haven't had an implant, but the FDA are now completely on board with it. So this heralds quite a revolution in the treatment of inflammatory disorders. And of course, the word has got through to the chronic fatigue community and the chronic fatigue research community. And there's a very good summary of the current state of vagus nerve stimulation for chronic fatigue, fibromyalgia, etc., POTS, the whole complex of MECFS type problems. On Health Rising a few months ago, go to the Health Rising site, such a good article. Like all Court Johnson's articles, very comprehensive, very easy to read, and often with, very convincing case histories and little video clips. I certainly recommend you to that site. It's also got an account of the research that's about to be undertaken by Dr. Natelson in New York, at Sinai Hospital. And that's looking at long COVID using vagus nerve stimulation. So there's a very bright future for vagus nerve implants for all inflammatory problems. Now, I'm talking about implants, surgically implanted devices. It's going to be a while before we see that in Australia, I'm sure. I asked a rheumatologist recently whether he knew anything about it. Very cluey guy. Didn't know much about it. It really hasn't hit our shores with any great impact. I hope that the publication of Kevin Tracey's book will make a difference to that, because a lot of people are going to be asking their rheumatologists, when can I get a vagus nerve implant? A lot of other people asking their specialists of whatever color, cardiovascular, gastrointestinal, psychiatric, whatever. So, a very readable book. It's a must read. You must have this book. Don't be just content with watching him on YouTube or anything. Do get the book. That's fascinating and it's very entertaining. He also goes into the whole issue of vagus nerve stimulation with non-implantable devices, that is transcutaneous, auricular vagus nerve stimulation. And he's experimented with them and endorses the fact that there is an effect, that it's not all pie in the sky and wishful thinking, that yes, there are definite effects. And certainly we have enough literature to know now that there are very clear physiological effects if you stimulate the vagus nerve through the ear branch, usually in the left ear, but it can be the right ear as well. I'll talk a bit about left versus right in a second. The ear, I'll talk a bit about the anatomy there. The ear has this auricular branch from the vagus, This auricular branch innervates the inside of the tragus, the little knobbly bit there in the front, and the concha, the inside of the concha, which is the inside of the shell of the ear, near the meatus of the ear, the external tube of the ear. So anywhere on the tragus or in this sort of area here can be stimulated and will affect the vagus nerve. And I came across such a fascinating piece of information about this. Somebody wrote a letter to New Scientist saying, because there'd been an article about vagus nerve stimulation. The auricular branch of the vagus nerve is called the Alderman's nerve. Why is it called the Alderman's nerve? Because Aldermans in the past, Aldermans being basically counselors, after a big meal, they would stimulate their ears with rose water so that they could get in another course of food. So nothing new on this earth. Alderman's nerve. So a great deal of research now on stimulating that part of the ear and what changes occur, for example, in heart rate variability, which is a measure of parasympathetic tone, heart rate, other physiological parameters, which I won't go into, and what effect it has on people's symptoms. Let's look at chronic fatigue syndrome. There are a number of studies now, and they are being carried out with increasing sophistication, and the results are positive. There's a very good little video from Dr. Courtney Craig on the Health Rising site on the vagus nerve stimulation, on her experiences with vagus nerve stimulation. And interestingly, she said that basically she got an almost immediate effect with pain, also good effects with sleep, mental clarity. She needed a low dose naltrexone. Not so much for overall fatigue, but generally speaking, she was functioning a lot better. Good little video. She also points out that you can overdo vagus nerve stimulation. If you're a particularly sensitive person, easy to overdo it. Do bear this in mind. If you're going to be using a vagus nerve stimulator, start with short periods. As short as 2 or 3 minutes, and see how you go with it. Now, before we go any further, let's talk about devices. And devices are being touted for basically everything: anxiety, depression, fatigue, irritable bowel, autoimmune problems, heart problems, you name it. Vagus nerve stimulation is the go. And a variety of devices are being advertised with huge number of different claims. All these should be approached with skepticism. The devices vary in price range, about $200 to well over $1,000. It's not clear that the more expensive devices are better than the cheaper ones. I had a look at the Biothm, BIOTHM, the Biothm vagus nerve stimulator recently. I had a look at it in action. Seemed a nice little device. It was programmed to the right frequencies, standard frequencies. It was easy to use, and it was about $200 Australian. The other end of the spectrum, there's the Parasim. I got this Parasim last year. It cost over $1,000. It's a very nice looking device. It does what it's supposed to do. It works by attaching an ear clip, getting the wire over the ear, and you program for that time. In a second, for time, I've got a program for 20 minutes. And then you move on and you change the intensity of the current until you feel some tingling, and then you lock that in. So all of these devices work in the same way. All of the ear devices work in the same way, which is you turn up the device until you get some tingling in the ear. It mustn't be unpleasant. And then you hold it at that level. If you want to change it during the session, you can do so. So, well, I might keep that going. There we go. Whoa, a bit too much. Okay, I'm going to keep that going while I'm talking. This is the beauty of vagus nerve stimulation. You can even be doing narrow focus, and you are still hopefully getting some vagus nerve effects. So the problem here is we don't really know which claims for which devices are valid, and there is no consensus in the scientific literature as to how long you should be doing it for, what frequencies the devices should be using, or any other parameter, current, frequency, waveform. We don't know. And there's currently a study underway in the States, the SPARC study, S-P-A-R-C, trying to tease out what are appropriate parameters for perhaps different conditions. But at this stage, we cannot know. I'm a little bit skeptical that there are going to be different parameters for different conditions. I think what we're doing here is we're facilitating vagus nerve communication with the brain to say all is well. And that's having a broad, non-specific effect on problems. Relaxation, especially deep relaxation, done regularly, has a positive effect on all conditions. I don't think there's any question about that. And of course, this was known to Dr. Ainsley Mears many, many years ago. Dr. Mears, the one psychiatrist in Australia who specialized in deep relaxation and its effects on psychological problems and physical problems, was a man so far ahead of his time, it wasn't true. He'd partly been influenced by yoga, and he'd gone to India and looked at what they were doing there and how the yogis were able to control a whole range of bodily functions through yogic practices. He developed this method, ataraxis, which was a way of relaxing. Very simple, very easy. You just had to do it. Still practiced by people like Pauline McKinnon, highly recommended. I used to go and see him back in the 80s. And again, you've heard me tell before. I remember one day in particular, I used to go for a session, but then he'd chat to me about what he was doing. And he showed me a before and after for someone with cancer in their lungs, secondaries from a melanoma. Initially, big secondaries in their lung. After doing a few weeks of deep relaxation, little tiny cannonballs, the cancer had shrunk. And he was not the only person, of course, back in the 70s and 80s to discover that deep relaxation affects cancer and most other physical and psychological problems. So, now so basically I've said all I want to say about devices. Until we know more, no clear-cut recommendations can be made about devices. The Parasim, which has been, I think it's been remarketed as the Neuropod. I think it's the same device. They claim, the Parasim company, claim that their device has participated in many more studies than any other device. It's got the best track record on research and actual trials of its performance. They claim they have a special protocol, that the frequency waveform protocol in their machine is unique and has been researched to produce the best vagus nerve stimulation. We don't know. If you look on YouTube at various people talking about vagus nerve stimulation, then most of them have been using the NeuroSim. But we don't know what is best. And we're going to have to wait a while for studies like the SPARK study to actually tell us what to do in more precise terms. Now, some devices stimulate the vagus in the neck. We don't know whether they're better or worse. Now, there was a query that stimulating the right vagus nerve wasn't quite so good for the heart, caused cardiac arrhythmias. That's certainly the case in experimental animals. But it seems that more recent findings in humans tend to suggest that stimulating the right vagus is probably okay. However, people like Parasim still recommend you use the left ear. And most people with ear stimulation devices recommend using the left ear still. Now, what about breathing? We've talked a lot about breathing in the past. At the end of the day, breathing, in my book, is the best way to stimulate, enhance, and encourage vagus nerve activity. So, and Kevin Tracey says he endorses breathing methods. Now, he did get Wim Hof in his laboratory. I will say no more about that. If you look on Health Rising and you look at Dr. Natelson's research on breathing in chronic fatigue and long COVID, you'll see he uses a box breathing protocol, 4-4-4-4. There's some mention of the 4-7-8 protocol, which originated with Andrew Weil many, many years ago. And I've never understood the rationale for it or where he got it from. The tested, tried, and true breathing method is abdominal respiration, 6 in, 6 out. That is the absolute gold standard for increasing heart rate variability and therefore increasing parasympathetic activity through the vagus nerve. 6 in, 6 out. You can't go wrong with it. It's very benign. You can see immediately on a heart rate variability monitor how it smooths out the heart's activity into beautiful, smooth, coherent waves of action. It clearly has a truly balancing effect on sympathetic, parasympathetic balance, balancing out parasympathetic, sympathetic activity. You can do other breathing ratios, 4-6, 4-8, etc., etc. It will still have an effect. But ultimately, we're looking at balance, the balance between sympathetic and parasympathetic. It's all to do with balance. So let me summarize. When we're talking about vagus nerve stimulation, we're talking about a quick fix or supplementary method, a technological quick fix to supplement good stress management. It's only ever going to be a supplement to good stress management. A recent paper showed that the best effects of vagus nerve stimulation occurred in people who were pretty stressed out and in women, interestingly. So I thought that was an interesting piece of information. But our stress management practice is our number one, and our main part of stress management practice is resetting as many times during the day as you can, not getting into narrow focus, not getting into worry and rumination, the so-called default network in the brain. Pulling yourself up when you find you're ruminating, thinking too much, you're in narrow focus, with too much screen time, too much phone time, pulling yourself up, resetting, just taking a moment to reset. Open your focus, expanding your awareness to infinity, and really making sure during the day that you take some decent breaks, at least in the middle of the morning, after lunch, middle of the afternoon, and winding down the evening. Don't wind down in the evening, you can't sleep. End of story. Unless you happen to be a very good sleeper. All social activities, most people with chronic fatigue, of course, find out pretty quickly you can't socialize in the evening. It completely does you in for days on end. Any interpersonal interaction, if your energy is low, is stressful. You've really got to take care of that. So the broad picture is moment-to-moment stress management and observing ultradian breaks and resetting as often as possible. Preferably have a good relaxation routine and or good breath routine at some point during the day for at least 20 minutes. And if you're going to get a vagus nerve stimulator, personally, I think it's probably safest to go with what the researchers use, but I don't have any evidence to back that up at all. So I'm done, and I'm open to questions.
Thank you very much, Paul. I've been in the background looking at all these different things. I've been posting some things in the chat. So if people want to post some things, save the chat, they can save that. It's just what you've been talking about. I kind of looked up online as well, backed up sort of some of the things you've been saying. AA can be really good in this case. It sort of gives me some short overviews of some of the things you were talking about, which has been great. Look, I've got a few questions, if you don't mind.
Go for it.
Okay. So probably help other people as well. Many of us have got chronic illnesses within the group. And a lot of the chronic illnesses like chronic fatigue syndrome, fibromyalgia, tick-borne infections and mould and so forth, I'm sure that this is the case, is that these things can really affect not only our body and pain and everything else, but this nervous system. And could these infections or whatever's continuing to drive the nervous system, which can then cause pain, can cause fatigue, can cause other things, which is why many people with chronic fatigue syndrome, they're told to rest and kind of recover and to pace and to do things like that. Do you think that first off, one question is, do you think that by resting and pacing and so forth actually calms down the nervous system, which is what resting and pacing actually does?
Absolutely. Absolutely. And I come back to this point about the brain and the immune system being one system.
Right.
And I put up this book earlier by mistake. I do recommend it. It's a very readable book, The Immune Mind, Monty Lyman, British guy. Of course, it's been known to medical hypnotists, for example, for centuries, that hypnosis can have profound effects on physical and psychological problems in subjects who can go into trance. And when we say trance, what I'm saying, the 10 to 20% of people who can go very deep and become very open to suggestion, like they suspend their normal brain activities. And this is a wonderful thing to do, to be able to suspend one's normal brain activities, particularly the activities of the default network, the so-called network, which supports daydreaming, ruminations, and dark thoughts. So anything we can do to calm the brain, calms the immune system, and allows it to get on with what it's supposed to be doing, which is fighting infections, if there are infections there.
Okay. So, because there's a lot of people with long COVID that also have huge issues with dysautonomia, other vagus nerve issues and nerve issues in general as well. So the question remains, is this infection, or like in long COVID, is there still an active virus? And in people with tick infections, for example, are there still continuing active viruses or bacterias or what's going on still activating the vagus nerve? Or has the vagus nerve or the nervous system in general been stimulated so much in the past that it's now got like a memory cell and it remembers its past sort of trauma of all of that acute stage, let's say, and now it's in this automatic kind of looping and it's gone haywire in the best sort of medical terms? What of those two? Or would it be a combination of both, depending on the individual?
Yeah. And of course, the answer is nobody knows the answer to that question. But there is certain...
Unless you could continually test for the infections and determine if they're still active, as in the virus and or tick infections and or mould and so forth as well. Now, if they're still active, well, would it be sort of logical and medical to say there is a possibility that is also still stimulating your nervous system? But if those tests are absolutely negative, but you're still heightened with pain and fatigue and everything else as well, do you then just look at trying to calm down this whole nervous system?
Yeah. Look, I think shingles is a very good example. Here's a bug. It's living in 90% of people. It's living in the nervous system. And it pops up when people, usually as a result of people being under chronic stress or having gone through an acute stressful period, then it flares up.
Yeah.
then the immune system gets back on top of it again. It's a painful condition. So when the pain persists, and therefore the stress from pain persists, it's more difficult for the shingles to clear up.
Yeah.
And I think the same applies to any infection which may be hanging around. Yeah. The duty of the nervous system is not necessarily to get rid of stuff out of the body, but just to keep it in its place. I mean, let's face it, we've got all sorts of bugs in our body that are kept in their place. And the latest theory about the microbiome is that actually it's there to repel parasites, and that it takes the immune system a lot of energy on a daily basis to keep the microbiome in its place. I mean, the microbiome is being looked at previously as just providing all these wonderful benign substances for the body and for the immune system, etc. But the situation may not be as simple as that. And I think, look, Peter, as you know, we don't know about persistent occult infections.
Yeah.
When they don't turn up on the usual panel of tests, what do you do? What do you say?
Yeah.
So the best we can do is say, well, hey, we just got to give the immune system as much support as we possibly can. And what supporting the immune system means is, again, incredibly open to question. There was a beautiful interview in New Scientist 2 weeks ago by a British immunologist at Imperial College, who's just written a book about immunology. And, you know, he's talking about things to support the immune system. And he said, look, with regard to substances, supplements, etc., I don't have the information to be able to tell anybody what they should be taking to support their immune system. But he could tell them to manage stress and sleep.
Right. And we're talking external stresses, aren't we, obviously? Because there's two forms of stress. Obviously, if you've got an acute condition or even a chronic pain condition or a heart condition or whatever, I mean, they're causing internal stresses on you.
Absolutely.
And then you've got external stresses. And a lot of times doctors, if they can't find an internal stress, i.e., as you said, with testing for infections and the tests come back normal, even though the testing is probably pretty faulty, they'll just put it down to, oh, you're stressed, which then quite often can really annoy a patient, because they're going to go, oh, we tell him it's all in my head and it's just stress and I need to just calm down. And that itself is a stress as well for so many people. I mean, many of us sort of think that's almost gaslighting by the doctor sort of telling us those things when we really feel, no, there's something else going on, because my home life is pretty good. I'm not under many external stresses at all. So that's a bit of a catch-22 for many of us, that going to a doctor could even cause stress as well.
Absolutely.
But coming back to calming down the nervous system seems to have a link to so many things, as in the immune system. And we were talking before about the heart. I'm having a few heart issues at the moment with the electrical system of the heart. So doing some stimulation for the nervous system hopefully could help also calm down atrial fibrillation or atrial flutter or things like that. Would that be right?
Absolutely. Absolutely. And I mean, coming back to the breathing issue, in the past, in some of the sessions I've done, I've talked about chronic habitual hyperventilation.
Yeah.
Dr. Nadelson, the guy at Mount Sinai, he's the only doctor I can see internationally that has followed up the idea that in chronic stress and in chronic fatigue syndrome and long COVID, you have marked abnormalities of breathing in up to 50% of people. Some British doctors have known this since the 1970s. And I was lucky enough to spend some time with one back in London in the 70s. Breath retraining for these doctors back then was essential in addressing a wide variety of problems. Dr. Nixon, who I studied with, he was a cardiologist. No patients went through his hands who had cardiac issues who didn't have breath retraining. He felt it was so important. And I'm in the process of sending Dr. Natelson some of his early papers, because I don't imagine Natelson is aware of this, about Nixon's approach to that. Very, very interesting. So addressing the breathing issue, again, either doing Buteyko method or doing simple 6-6 breathing in a very relaxed way. This is absolutely the way to go. Because the thing that gets stuck, we know from, again, a lot of nice articles on Health Rising about research on sympathetic nervous system overdrive in chronic fatigue. You know, a recent one, after exertion, the sympathetic nervous system remains on far too long, i.e. it is not being damped down by the parasympathetic nervous system. If the parasympathetic nervous system weren't doing anything to the heart, it just races away. The parasympathetic tone has got to be there all the time. So doing the breathing, getting an auricular VNS machine, these are all things which are going to help the process to get out of this loop of stress, pain, and fatigue.
Okay. And there are a number of programs that are available which are being recommended by even some doctors now. My doctor recommended that too. He said, look into the Gupta program, looked into DNRS, and there's ANS retraining, and there's quite a few of them, and there's a lot online. Someone like myself with such a logical brain and a scientific brain, I look at that and go, oh, how could just sitting there and breathing in and out, help you and so forth? But there's a lot of recovery stories where people were really, I guess they followed everything biological, and they did the supplementation, they changed their diets and changed their lifestyle and everything else as well, and probably set themselves up to be pretty good healthily, biologically, but they still had long COVID, or they still had tick infection like illnesses or fibromyalgia or chronic fatigue syndrome. We don't know what those caused by. But when they did these programs, which could take 6 months to 12 months actively doing them every day, they started to recover and they kind of eliminated their conditions. So that's really, really interesting stuff. And there's, I guess, two camps: people who don't believe in it at all or tried it a bit and didn't do anything, and those who have completely recovered. What's your thoughts on some of these programs? Have you seen many of these particular programs?
Yeah, and, again, I'm skeptical that they offer anything new that you just can't do by doing the basic. Listening to Pauline McKinnon every day for 20 minutes twice a day.
Yeah.
The thing about many of these programs, I think, is that people pay their money, therefore they do it. And it's got the bells and whistles of modern research speak, or neuroplasticity and, the dorsovagal nucleus of the vagus and all this kind of nonsense, polyvagal theory, et cetera, et cetera, et cetera. So people these days want a bit of technology. They want a little bit of technological magic.
Yeah.
Doing simple breathing or doing the Ainsley-Mears ataraxis routine, which can be boring. It's not appealing.
Yeah.
But the facts of the matter haven't changed. They are producing the same results as yoga nidra, the yoga of sleep, has been doing for hundreds of years.
So old stuff repackaged in new labels and so forth.
Yeah, you put it well. I'm not going to decry them because they get results.
Yeah.
It's a repackaging of some very basic truths. Yes.
Yeah. What else did I have? I think, coming back to your question before, and we talked about it before, this is this hidden sort of heart rate rhythm and this over breathing. And I sort of went, well, I'm not conscious of over breathing. I'm not sort of hyperventilating. And you mentioned that if you record this, that your breathing rate can change and can drop down. And even this can cause an issue with the whole nervous system stuff. And so subconsciously, you're not even aware of this. So is that correct? Plus, how would you measure that, though? Does a 24-hour heart rate monitor measure that kind of thing?
No, you just measure your blood carbon dioxide level.
Okay, so you need to get one of those.
It's dead simple.
Right.
It's dead simple.
Oh, sorry, the device is called a carbometer. So you have to get one of those. Capnometer to get yourself.
Capnometer.
Yeah, which we did talk about in some of our talks before and
Yes.
and so forth. So again, I was saying, I don't think any cardiologist I've seen has got those, probably wouldn't know what they are. You have one, I know, and you used to see people with that. But I guess we've got to look online to try and buy one ourselves for a couple $100, I think they are, to try and measure.
Yeah, well, that's the one I think you were circulated people about some while ago, the Contec. It's about 400 Australian, I think.
Yep, and it measures your carbon dioxide levels.
Yeah.
Yep.
And the point about chronic hyperventilation is that we don't know we're doing it. It's very subtle. But in the long run, it means we start running a low CO2 level, a low carbon dioxide level. Therefore, we become alkalotic. The blood becomes alkaline. Then calcium and magnesium don't work properly. Then the heart develops arrhythmias.
Right. Then
muscle spasm. Then chronic weakness sets in. And a whole cascade of effects from this something which is so simple.
Yeah. Very interesting. It seems to be a lot of this information you were aware of in your days, but modern cardiologists and GPs and so forth, their way of tackling chronic illness or any illness now is just give you a pill and hope for the best.
No one is aware of chronic habitual hyperventilation, even though there's a vast literature on it, mainly British, some American, some French. And it's sad because it is such a basic thing. It causes so many problems, and it's easy to address.
Thank you so much for putting the time and effort with us today.
Pleasure.
Someone said, please tell us again about this device that can measure hyperventilation. What's it called again? Capnometer?
Capnometer. CAPNOMETER. Capnometer.
Okay. I'll see if I can find that one that I found last time and put it in the show notes. Sort of box with a little white tube on it, which you stick up your nose.
Well, that's basically it.
Basically it.
It's a little box, and it tells you what your carbon dioxide level is as it comes out of your nose, as the air comes out of your nose.
Right.
And if it's below 30, you're probably hyperventilating.
Okay. And that's just while you're sitting there. Yeah. Okay.
Simple as that.
I'm wondering if a sleep apnea test at night, which I have done in a hospital, whether they actually measure your oxygen and also carbon dioxide levels.
I don't think they measure the carbon dioxide routinely.
Interesting. Okay. Well, thank you once again. And everybody enjoy this video, which we're going to put up online as well in the next few days too. So look out for it.